Hi, Dr. Garima here again, and hopefully the voice is more louder and clear today. I think I was not using my volume 100%, but anyways, I've ordered a mic from Amazon today. Let's see how that works. Changed my desktop. My son broke it. The screen basically, not the entire desktop. What to do, toddlers? Some emergency fund has to be kept for that. Anyways, let's quickly start and finish another three of the other professional questions that we have started. I finished in the last session 5 questions. Today I'm planning to do three because there is a lot to talk about ethics and professionalism. As I mentioned, that there is no particular textbook that teaches you that. There is no particular session in your graduation dentistry of 5 years. Imagine you are 5 years and then there is no single teacher who takes a session on professions and ethics, and you're just expected to know, you're just expected to understand. Uh, that's not how it should work. I always feel every teacher of every subject should take one class on ethics and professionalism based on that subject, and in general too, that prepares you for professional life. Because like I mentioned in my last video, when you're doing your internship, you're just switching your clinical what do you say, postings. You are not comprehensively attending to one patient as a whole. You'll be in the OMDR department, you'll do your checkup and diagnosis, and you'll refer. The patient goes to endo, the intern posted there would just focus on that tooth, finish the endo, refer to prosto. There is no actual dialogue happening between you and the patient, where you understand the wholeness of the situation, the patient requirements, and you are not the one who's treating the whole mouth. So there is a big breach, or rather gap, I would say, between the way you learn professional ethics as you do in the private practice, and then you come and join a locum and with some other dentist, and it's there that you start understanding how to talk to the patient and how to be lenient on some, and how to maintain a relationship with the patient. Some people may go overboard or be over friendly, some be very stern and strict, some be very professional, some be with a lot of empathy, and a good doctor who understands the patient's wholesome problem, not just the dental, what is going on. You start talking, and those kind of dentists usually have great practices because half of the problem of the patients get solved when they enter the dentist office. So if they find a familiar face who is open to listening to their problems, they are more likely to come back to you. And of course, you have to be competent, it's not just your talk. So, anyways, profession ethics. So, here my focus is not just to solve the questions, but that session which I keep on saying that the dentist graduate should have had. I'm trying to disperse some of the informations that I have learned from my years and years of practice. And my dad's an ENT surgeon, by the way. So, as a child, often I used to sit in his cabin and I used to watch him talk to the patients. So it's kind of ingrained in me as to how to approach a patient and make them feel comfortable, because I've seen my dad doing so from very early stages of my life. And probably that gave me an edge over the other people who were the first generation doctors and did not have this exposure. So I learned a lot of things, and being grown up, so my dad's friends were also doctors, most of them, and having seen how they talk to the patients, etc. From early on in life, I could just catch that communication aspect. Uh, but it's just that now I realize that many of them don't, right? So I never had to kind of hesitate or suffer when I immediately jumped on with my private practice. But I do see people struggling with that aspect. So be the change you want to be, like I mentioned, and that's why I'm keeping this session only to 3 questions, because as and when each question comes, I just start giving out more and more tips and tricks that may help your practice. I may not be a professor in a college because I'm more of a private practice person, but I have deep academic inclination. Like I was top of my class, I cleared my All India postgraduate exam rankist. I stood first in my pediatric dental in my state. So academic also is a deep inclination. I swear, if I had a college next to my home, I would have definitely joined there as a professor. But it's just that there's so many things to juggle after having a child that it's just not possible to travel long distance. Yeah, we have colleges in Dubai, but they are like almost 1 hour away. I can't do that with my private practice. But yeah, if I did have a chance, I would definitely take it up. So, anyways, let's just jump to the question. So, this is the book that I have written, and getting great responses from it from my own candidates and others too. So here I have included from ODEL, therapeutic guidelines, infection control, ethics, consent, COVID, and public health dentistry, all from ADC resources, not from any random resource. The books mentioned by ADC, and I've made scenario-based questions on it so that it's easier for you to read, because these books are just information, but when it comes to solving scenario-based questions or single best choice questions based on them, then you start struggling. So I've made questions on them and whooping 440 SBQs to help you revise. I would jump on to now page 36. Yeah. So last time we finished in ethics 1 to 5. That's the previous video if anybody wants to watch it. Now I'm going to solve question number 6, 7 and 8. Let's start by solving question number 6. Which of the following best reflects the ethical principle of non-maleficence? What is maleficence? Non-maleficence. It means to do no harm. I know it's a big word. Why couldn't they have just used the word reflects the ethical principle of doing no harm? No, but that's a word called as non-maleficence. So which of the best reflects? Best reflects. So which option basically is the definition of non-maleficence? Avoiding harm to the patient, encouraging cosmetic enhancements, delegating procedures to assistants, performing procedures based on cost. Okay. Now let's take each option. I'm not just going to jump directly on the answer, though you can see it, because I want you all to understand, because question can be made on either of the options, and if you know the concept, then it should not be a problem for you to solve any question. Performing procedures based on cost. Okay. Say a patient comes to you and says that they have financial problems and the tooth has a deep cavity with an abscess. Now the patient doesn't know what options are available, so you take an x-ray and you explain to the patient. Now you can give the option of root canal with a crown, and you can give the option with extraction, because ultimately the pain problem has to be solved. I'm saying root canal assuming the tooth can be root canal treated. Now if you think that the patient already has financial problems and you think the best option would be to save the tooth, of course, but since the patient cannot pay, let me not give him that option, let me just give him the option of extraction. That is maleficence. That is you doing harm to the patient by not giving him the options. Let the patient decide whether he wishes to proceed for root canal or whether he can go to a community dental clinic where it can be done free of cost. But you should not harm the patient thinking that if I tell him, root canal will be expensive and I cannot do it here, but if he could go to the community dental clinic, he could get it done there. But by saying so, then I would be losing the patient and the little money that I can get from extraction, and that's why I'll tell him just to do extraction, then that is doing harm. You understand my point? So performing procedures based on cost is a metaphoric example that I've just given. Your job is to be very truthful, honest, and give all the options available. Even if the patient cannot do the treatment at your place because it's expensive, you can refer that patient. You don't have to retain that patient onto you in order to earn that little bit amount of money. And this, again, I'm so sorry to say that this is happening so often. Like I I deal with children, you all know that, right? So I get 8-year-olds and 7-year-olds who had an abscess, say 2 months ago, and then they go to a general dentist who, instead of referring them to the specialist, Because I'm not saying they're not competent, but in case a general dentist is not comfortable treating a child's milk tooth, say a molar who still has, say, 3 years to fall off on the x-ray, even if there is an abscess, what they'll do is they'll just open up the tooth, and without cleaning the complete root, they'll just do a partial pulpotomy, which temporarily solves the pain problem, but then it exacerbates within a matter of 2 or 3 weeks with a bigger abscess. And then the patient realizes that this treatment did not work, and they went and they paid, and then they search for a pediatric dentist, and then they come and they say, why didn't the general dentist refer us to a pediatric dentist if they did not know about it? I have nothing to say at that point. Like, I know that they held on to you to earn that little bit of money, thinking that temporarily it will solve the problem, and if and when the pain arises, we'll deal with that later. But then you ended up doing more harm, right? Now the child suffered then, the child suffered now, and sometimes they have done such a bad job that the root is further abscessed. And when I see the previous x-ray, the root was a little decent, where I could have fully done a root canal, but now because that much time has elapsed and the infection has grown because of a shoddy work, I have no other option but to tell the patient, I'm so sorry, I have to remove this tooth. Had you come earlier, I would have saved. And at that point, the patient says, but doctor, we did go to a dentist, but he said he could do it. Why didn't he refer us to you? You get my point? So that is doing harm. So that is maleficence, and you should not do that. Many a times in my own practice, patients sometimes come and say, doctor, can you extract our third molars? Now, I am good with extractions, but I feel sometimes that there are so many newer methods that have come for extracting third molars in adult patients, I'm saying, that I feel it's best if the patient goes to the oral maxillofacial surgeon who has better skills, because he's doing that on a daily basis. Yes, I'm good with extractions, but I'm not that skilled as an oral maxillofacial surgeon for a third molar extraction with those kind of tools. So why make the patient suffer with me? Suffer as in, I would say, spend a lot of time with me, because I will take more time, of course, because I am not that well versed with third molar extractions. So I just frankly tell the patient, I can do it, but it's for your benefit, and I want it to be done very skillfully in the shortest span of time, that I would rather refer you to the oral maxillofacial surgeon. There is no shame in telling the patient that in that aspect you have limited skills, but you want the best for the patient, so you refer. Big deal. I mean, the patient actually will appreciate you, and he'll ask you for the referral. Doctor, do you know anybody whom you can refer? You just call up your colleague, and that's how a referral system is based. Your practice will boom. Patients know that you're telling the truth, and once they are done with that part of their extraction or something, they will come back to you, because they know that you were very honest with them. And the colleague that you referred, because you know the work of that colleague, he's done a good job, he's happy you referred a patient, the patient's happy he's got a good job, you are happy that you could help the patient. Why not? Why you want to do everything yourself? You're getting my point? So that is what performing procedures based on cost means. Now, delegating procedures to assistants. Okay. Now say, how do I give this? Okay. Now, even a simple procedure, for example, how delegating procedures to assistants is non-maleficence, like do no harm. How would you avoid that, and how does it harm the patient actually? Now, for example, even if it's a small cutting the wire, now you do braces, example, and the patient comes and he says that one of my bracket came off, doctor, can you fix it? And say you're in a hurry, or you're not there, or whatever reasons, you just ask your assistant to do it. Okay, no matter how much the assistant may have been with you for so many years, she is still not a dentist, okay? And you're placing your patient in somebody else's hand who technically doesn't have that degree or the competence. She may have seen you do that thousands of times, but there are so many nuances that you have to take care when you place a bracket that you just cannot delegate it to your assistant. Doing so may just screw up the case, like for a short period of time before you correct it, but it's still doing harm, right? So, delegating procedures to assistants is doing harm, correct? So, possibility of doing harm. I'm not saying intentionally anybody's going to do harm, but there's a possibility of the patient getting a wrong treatment or hurt, etc. So, no, you cannot ask them to do that. So, yeah. Encouraging cosmetic enhancements. Wow. You all know where this is going. Wherever you go nowadays, the patients will be like full of veneers and laminates and even things which can be corrected with the help of Invisalign nowadays or the traditional braces. I have seen many dentists intentionally doing root canals for many anterior teeth and then giving crowns. And one of the cases that I myself had experienced was opposite my building. It was my cousin sister's friend, and she was just 19 at that point of time. 19, okay? And she went this to a GP doctor in Mumbai, and she had her teeth a little protruded, okay? The ideal treatment should have been extraction of two premolars and putting with the braces the teeth back. But they were not given that option. They were giving an instant option that in 1 week we'll straighten out your teeth the way you want. And they intentionally did RCT of 12 of her teeth because they grinded her teeth so much in order to reduce the protrusion and then gave her full laminates and crowns. So, this is encouraging cosmetic. I mean, to that young child, 19, what is 19? Nothing. 19 is nothing. You could have pushed her towards the right treatment, which is to get orthodontic treatment done, because doing root canals at such a young age, intentional one, especially when you're not even in that profession of, say, movies or something that you require it immediately, you're just a normal person, is wrong, you know. But then who draws the line? And I remember that girl, Disha, that was her name, she suffered so much because firstly the root canals were not done properly. So she got reinfections, her gums got swollen, and she kind of went into depression because the gums were swollen. It was hurting her so bad that the crowns had to be taken off. So you just imagine, just cut off teeth, just kind of stubs of teeth were remaining, and she had beautiful teeth, just they were a little protruded. So she said they never gave us the option of going to an orthodontist. Now I don't know what transpired between her and the dentist, but this is what is maleficence. You are doing such a thing to such young children, but it's rampant in various parts of the world. So that's why, again, I say you should always have a class like this. But anyways, if you are a freshly passed out graduate who's listening to this video, learn. Do no maleficence, please. So the answer out here is A. What does it mean? Is avoiding harm to the patient in so many different ways. You understand? A patient shares they are being abused. What is your ethical responsibility? Okay. This may be rare to encounter in your practice, but it may happen. Like, it may happen. You may see a child. Actually, in India, I would say, I've rarely witnessed anything like this. But I do understand in Western countries, as there are many foster cares and the things that you see in the movies, parents get divorced earlier, the child is, it's the cases are more common. So basically, if a child comes to you, or even an adult for that matter, and you'll have situations like it's a very hot day and yet the patient is wearing full sleeves up till the neck. Patient seems stoic, and if accidentally you do find out that there are marks on the hands, you tend to ask what happened. And if the patient is alone in your room and they get overwhelmed, they might say that they are being abused. At that point of time, what are you supposed to do? You have to report such cases. I know it is patient-doctor confidentiality, but you have to see the bigger picture of the patient's life. And then you have to report it as a mandatory reporter. Dentists in Australia are mandated reporters in case of suspected abuse, especially involving minors. You understand? See, these may be developed countries, but the personal life, I don't know how it is. Like, when I personally went to Australia, I didn't find it great. Like, I don't know. I'm from a place where there is so rich culture. We have such great families. The idea of just being isolated was not going down with me. I mean, there are people who are raised like that, and since they are comfortable, great. But yeah, these things are more common in developed countries. I mean, at least having seen so many patients in India, I never once encountered any case where there was an abuse happening. So, but such things may happen in Australia. So, what you should do when you come to know about it, you have to report it. Whom do you report it? You have to call a social helpline, and you have to report to them, or their child protection services, you have to report it to them. And the last question for today: a dentist continues using outdated techniques despite new, safer alternatives. This breaches what? Autonomy, veracity, competence, and justice. Okay. Say as metaphor, we live in the age of computers, right? Now, if you go to a place where they're using typewriters, are you going to continue to get your work done in that place? No, I mean, it's not wrong, but it's going to take more time. It's time consuming. You can't send an email, you can't do this, you can't do that. You can just you can just type a letter, it's a typewriter. So, would you blame that person? No, you'll ask him to up his skills. You'll ask him to invest in latest technologies and learn that. And that's what you expect from your dentist, right? When there are new techniques available which are more easier, more convenient, efficient, then you as a dentist should not think that I've done my BDS, I've done my MDS, now it's enough to study and that's it. That's where my line stops and I'll continue to do what I've just learned. No, the skills, that's why conferences are there. That's why papers are published. You should read them. If there is something new, you should learn them, because you are a treatment provider and you are providing the current treatment based on the current things that you have learned. Now, if there is an upgrade, you're not going back to your dental school to learn their upgrade, but you'll have to take some courses to learn that so that you can provide the best treatment possible for your patient. So that's called as competence. You have to keep updating your skills. So if you don't do that, then that's the breach of your ethical duty, and that is competence. You understand? So thereby we finished 3 questions, and it's a lot to talk, and I don't want to elongate my videos. I think 15-20 minutes is enough. Then even your attention span will go away. So yeah, anybody wants to have this book, just message me either here on YouTube, or best is to email me on adcwrittenmocktest@gmail.com. I've mentioned that in the description, and I will reply back to you. And hopefully you understood this video and the things that I was saying, and hopefully that helps in your private practice. Feel free to share any of your experiences in your private practice that can benefit the rest of us, including me. I'm still a student, I still learn. So it's nice to get a feedback, and thank you. Bye bye.